Hello everyone, welcome back. Today I will talk about otitis externa in children. Otitis externa is also known as swimmer's ear and it is defined by inflammation and exudate in the external auditory canal in the absence of other disorders such as otitis media or mastoiditis. The most common bacterial pathogens are Pseudomonas aeruginosa, especially in association with swimming in pools or lakes. Another important organism is Staphylococcus aureus. Now, otitis externa develop in approximately 20% of the children with tympanostomy tubes, and this is associated with Staphylococcus aureus, Streptococcus pneumoniae, Moraxella catarrhalis, Proteus, Klebsiella, and occasionally anaerobes. Now, coagulase negative staphylococci and corynebacterium are isolated frequently from the cultures of external canal, but this represent normal flora. Now, malignant otitis externa is caused by Pseudomonas aeruginosa in immunocompromised person and adults with diabetes. Now, otitis externa cases peak in summer, in contrast to otitis media, which occur primarily in colder seasons in association with viral upper respiratory tract infections. Now, there are certain conditions which can predispose to otitis externa. Cleaning of the auditory canal, swimming, and in particular diving. This is because these conditions disrupt the integrity of the cutaneous lining of the ear canal in the local defenses such as cerumen, and all this predispose to otitis externa. Now the clinical manifestations. The characteristic findings of otitis externa are pain, tenderness, and otorrhea. Otorrhea means oral discharge, ear discharge. Now fever is notably absent and hearing is unaffected. Now tenderness with movement of the pinna, especially the tragus, and with chewing is particularly characteristic, and these symptoms are notably absent in otitis media. Now on inspection, the lining of the auditory canal is inflamed with mild to severe erythema and edema. There is scant to copious discharge from the auditory canal, and this may obscure the tympanic membrane. Now the symptoms of malignant otitis externa are also similar, but facial nerve palsy occasionally occurs. The most common physical findings are swelling and granulation tissue in the canal, usually with a discharge from the external auditory canal. Now the diagnosis of uncomplicated otitis externa usually is established on the basis of clinical symptoms and physical examination finding without the need for additional laboratory or microbiologic evaluation. But the cultures are required to identify the etiological agent and the antimicrobial susceptibility. Now the differential diagnosis. Otitis media with tympanic perforation and discharge into the auditory canal may be confused with otitis externa. But pain on movement of the pinna or tragus, typical of otitis externa, is absent in otitis media. Another differential is mastoiditis. Local and systemic signs of mastoiditis indicate a process more extensive than otitis externa. Now, malignancies or cholesteatoma presenting in the auditory canal are rare in children, but they may present with discharge, unusual pain, or hearing loss. Cholesteatoma is a mass-like keratinized epithelial growth in the auditory canal. Now the treatment. Topical antimicrobial or corticosteroid otic preparations are sufficient in most cases of otitis externa. These include ofloxacin, ciprofloxacin with hydrocortisone or dexamethasone, and polymyxin B neosporin hydrocortisone. Now these preparations are equally effective and are active against Staphylococcus aureus and most gram-negative bacteria including Pseudomonas aeruginosa. But none of these antibiotics has any antifungal activity. Use of aminoglycosides such as neomycin should be avoided in cases of tympanic membrane rupture due to their ototoxicity. Now, tympanostomy tube otorrhea is best treated with quinolone otic drugs. These are considered less likely to be ototoxic. Now, treatment with topical otic analgesics and cerumenolytics is usually unnecessary in otitis externa. With any topical therapy, it is important to remove the purulent discharge from the external auditory canal, and this is done with swab or suction, and this permits installation of the solution. Now, excess water should also be removed after bathing, and the ear canal may be dried using a hair dryer. The predisposing activities such as swimming or diving should be avoided until the inflammation has resolved. Now, fungi such as Aspergillus, Candida, and dermatophytes are occasionally isolated from the external ear, but it may be difficult to determine whether they represent the normal flora or the cause of inflammation. In most cases, local therapy and restoration of the normal pH as recommended for the bacterial otitis externa are sufficient. Now, malignant otitis externa is treated by parenteral antimicrobials with activity against Pseudomonas aeruginosa. These include extended spectrum penicillin such as piperacillin tazobactam, cephalosporins such as ceftazidime and cefepime, or fluoroquinolones such as ciprofloxacin. Now, complications and prognosis. Acute otitis externa usually resolve promptly without complications within 1 to 2 days of initiating treatment. Persistent pain, especially if severe or if accompanied by other symptoms, for example fever, should prompt re-evaluation for other conditions. Now, complications of malignant otitis externa include invasion of the bones at the base of the skull, and this may cause cranial nerve palsies, and a mortality of 15 to 20% occurs in adults with this condition. Now, relapses within the first year after treatment are common in otitis externa. Now, in the end, prevention of otitis externa. Overly vigorous cleaning of an asymptomatic auditory canal should always be avoided. After swimming, the auditory canal can be dried with 2% acetic acid, boro solution, or diluted isopropyl alcohol. These may be used prophylactically to help prevent the maceration that facilitate bacterial invasion. Now, there is no role for prophylactic otic antibiotics. Okay friends, thanks for watching. Please like, share, comment and subscribe to my YouTube channel for more informative health videos.